Good morning and welcome to Columbus Public Health. Thanks for everyone being here this morning. My colleagues from our 4 hospital systems, the Central Ohio Hospital Council and Franklin County Public Health, have joined me to provide a critical update to our community about COVID-19. Joining me today are Chief Medical Officer Dr. Andy Thomas and ER nurse Nate Royster from the OSU Wexner Medical Center, Vice President of Quality and Patient Safety, Dr. Amy M., and ICU nurse Jennifer Hollis from Ohio Health, Chief Medical Officer Dr. Nicholas Creatsulis and COVID Med-Surg Unit Manager Tracy Hayes from Mount Carmel Health System, Chief Medical Officer Dr. Rustin Morse from Nationwide Children's Hospital, Jeff Klinger, President and CEO of the Central Ohio Hospital Council, and Dr. Miller Sullivan, Medical Director of Franklin County Public Health. Again, thanks all of you for being here this morning. As we soon head into our 3rd year of the pandemic, we find ourselves at yet another critical juncture in this COVID-19 fight. Over the past week, Franklin County cases increased again by 11%. to 341 cases per 100,000, indicating very high community transmission. Our positivity rate is now at 11.4 compared to 8.6% just a month ago. And hospital admissions have increased 2% just last week, and that's on top of the 19% increase just 2 weeks ago. These trends are placing a tremendous and dangerous strain on our hospitals as well as our frontline workers who have been tirelessly working since the beginning of the pandemic. Here to tell more is Dr. Andy Thomas, Chief Medical Officer of OSU's Wexner Medical Center and Zone 2 lead. Dr. Thomas?
Good morning, everyone. It's a pleasure to be here. Thank you, Mashika. So I'm here to represent the over 40 hospitals and health systems in Zone 2 that stretch from the counties in central Ohio up to the northwest to kind of the upper Sandusky and Bellefontaine areas, and then down 23, down 33, and out 70 east, that southeastern quadrant of the state. What we've seen over the past month has been really interesting. We, of course, had the Delta surge. Started over the summer, and we reached a peak of hospital census in September of around 1,000 patients with active COVID in our zone in the hospital. Now, this time last year, on our worst day in December of 2020, we were at around 1,200 patients. By the first week of November, we had gotten back down from 1,000 patients down to about 400 patients in the hospital. But over the last 6 weeks, we've done nothing but have a steady increase to the point where we're now near 900 patients in the hospital with active COVID again. If you look at the admissions and discharges, our admission rates are as high as they've been since last January in terms of the actual number of people being admitted every day. Even though our numbers have stayed flat for the past week, that's been based on really high numbers of discharges too. So I know at Ohio State, we are today tied for our highest numbers of patients since mid-January of 2021. And many of you know last Friday we made the difficult announcement, as some of my other colleagues here have done over the past week, of limiting elective surgeries for inpatient cases to preserve bed capacity for COVID patients. So not only are we in a really difficult spot today, but what we see going on in Northeast Ohio is incredibly concerning. This is not going on in Europe. This is not going on in Asia. This is not even going on in New York. This is going on in Cleveland, in Akron, Canton, and Youngstown today. Dr. Roberts talked about our increase in cases here locally. In Cuyahoga County, they've seen a 4-fold increase in cases from an average of 500 to 600 per day to over 2,000 a day just in the past week. And as many of you know, on Friday, the governor asked the National Guard to actually deploy and mobilize non-clinical staff to work in our hospitals. People just to help with food service, to help with transporting patients, to help with cleaning rooms. Our colleagues at the Cleveland Clinic have a significant number of their staff. They live in these same communities. They are actually out sick. This is a coming crisis for Central Ohio in a way we probably haven't seen before And that's shocking to say, given what we've seen since March of 2020. This is going to be serious over the next 2 to 4 weeks, and we need to be prepared for it. So for every business owner in this community, if you want to keep your business open, I think you need to go back to masks for your employees and masks for your customers. If you are a school district who plans to have in-person classes in January, you need to be prepared to do masking in the classroom, in school settings, or your school will most likely have so many kids out sick that you will have to go back to virtual class. This is critical for people to think about these things now and not wait till the first week of January when it's gotten worse. Take this time over the next 2 weeks when things are a little slower in your business or slower in your school district. People are now off for the holidays to plan what is it going to look like in January. So with that, I'm going to turn things over to Nate Royster. Nate is one of our outstanding emergency department nurses at Ohio State. He has been on, and his colleagues have been on the front line of this now for going on 22 months. Very proud to have him here today to talk a little bit about his experience at Ohio State. Thanks. Nate.
Thank you for having me. My name is Nate Royster. I've been an ED charge nurse at OSU for the past 2 years. It's been a little bit crazy, to say the least. A year ago, I was getting, the very first COVID vaccine with 29 other individuals, going into the next year very hopeful, very, grateful, very humbled, and, excited for, a change or an end of this, pandemic. And now we're kind of hitting this wave where we're starting to see the, these new variants and, not enough vaccinations and people not wearing their masks, to where we're kind of backtracking and backpedaling and getting into a worse spot than where we were previously. I can speak for all the EDs in Central Ohio. We are completely full, completely congested. We've been on citywide divert, which is where, 3 hospitals in Central Ohio end up being so full that they need to divert patients away because they just simply don't have the staff or the capacity to care for patients anymore. So when 3 of those hospitals go on, then the whole city has to cycle through, sharing the medics as they're dispersed through the city. And that just creates even more congestion. We've seen record numbers of patients in our lobby. We've seen a lot of patients that are stuck down in the ER waiting for a bed upstairs because there's just simply no place for them to go, whether that be staffing issues or whether that be just no beds available for any physical space. It's been very challenging, and it's very hard to kind of be there and be the person that sorts who gets a bed and who doesn't. When there's 60 people in front of you and they're all there for different complaints and all of them, feel like they are at the worst time of their life or they're feeling the worst symptoms they've ever felt, it's hard to sit and morally decide who gets to go back next, who gets to go. Is it the person who's been waiting in the lobby for 16 hours, or is it this person who's coming in as a level 1 stroke? And it's just very difficult, and we're, working as hard as we can. Nurses are taking extra patients. We're going out of our way to accommodate as much as we can. And we just have to kind of meet people where they're at and try to explain to them as best as we can that we're doing everything that we can. If we had it our way, we'd be treating everybody all at once. We'd be getting everybody seen as soon as possible, but we just simply don't have the space. And what I try to tell patients is it's just like Amazon, how your packages are showing up a little bit late. And, they just don't have the employees or the staff to deliver those packages on time. So all the patients are stuck in a warehouse and we want to deliver you to a patient bed, but we just simply don't have the staff and we simply just don't have the capacity to do that. Getting vaccinated and, wearing your mask and everything, we've seen in the ER that the patients who are vaccinated and also have gotten their booster as well are able to be discharged if they do come down with COVID. They're able to just be discharged and can, monitor themselves at home. But the people who don't have any type of immunity built up to the vaccine or to the virus or no vaccination whatsoever, these patients are getting, admitted to the ICU. They're getting admitted to the progressive care units, and they're having hospital stays that are way beyond what they would normally need had they gotten the vaccine. And, people look into you in the eyes and they're like, I didn't get the vaccine. Can I get it now? And it's just, we can't do anything at this point. We just have to monitor and treat you and treat your symptoms and do the best that we can to, keep you as healthy as possible. But when there's physically no space, it just makes it a lot more difficult and a lot more challenging. And even the people who don't have COVID and are coming in for, their chronic health conditions such as heart attacks or strokes, they're receiving issues receiving care as well because there's just simply no space whatsoever. I'm very proud to be an ER nurse, and I'm very proud of all the ER nurses, not at OSU, but also across the state. We're doing everything we can. I know that everybody's working tirelessly. We've gotten no break. We don't know what we're walking into. We go into a patient's room. We don't know if they're COVID positive or COVID negative. We're the ones doing the initial testing. We're exposing ourselves and putting ourselves at risk. So we're really on the front lines down there. We've seen, staff members that come down with COVID, and it's led to severe staffing complications, just because there is just such a large volume of people and we don't know what we're necessarily walking into. Even taking the appropriate PPE precautions, it's just a high risk environment for all the nurses, and we're seeing a lot of fatigue and a lot of burnout going on because nurses are just simply run down for all 12 hours that they're there, and nurses are also dedicating extra hours to help cover in those gaps that we have in our staffing, and that just leads to even more fatigue and more increased risk for COVID. So if you can just do what you can to wear your mask in public, please get your vaccinations before going around your family members. You don't want to be, the reason that someone in your family ends up in the hospital because you exposed them to something that you didn't know you had. And with that, I will pass it off to Jennifer Hollis from Ohio Health, ICU nurse.
Hi, I'm Jennifer Hollis, and I am a critical care nurse at Riverside, and I would just like to thank Nate and second everything he has said. It's breaking my heart. It's breaking my heart every day going into work and continuing to see people die when I know that it could be prevented. I could stand here and tell you the data all day long, but I want you to hear my story and hear how this weighs on my shoulders every day. These patients aren't just my patients or a number. They are your mother, your father, your daughter, your grandson, and in my case, my great uncle. We are not exempt to this either, and we have also suffered. Whatever I can do to prevent any more death than what I am seeing every day, I'm going to continue to stand up and be here, and I will fight for you even when you won't fight for yourself. I'm so entirely grateful for all the nurses and doctors and patient care assistants and transporters and cafeteria workers and housekeepers for everything that they continue to do, but we are struggling. Help us help you. Please get vaccinated. Please get your booster. The biggest thing that I can say that I see every day is that people keep coming in and holding the hands of their loved one that made the choice to not get vaccinated, and that is what I am seeing in the ICU. And they're asking me for a miracle, and I am so sad because that's all I'm seeing are miracles around me every day. We asked and prayed for people to save our lives, and they gave us a vaccine. We asked to see our families during quarantine, and they gave us home COVID tests. And it's entirely frustrating to feel like those prayers and miracles are not being heard, because they are. So please, I'm begging you, get vaccinated, do your home COVID tests, get your booster. And if it's not for yourself, do it for your loved ones as well. Because we don't have any beds, we are very full. And I don't want to have to make those decisions about who comes and gets a bed and who doesn't. I feel like I speak on behalf of a lot of ICU nurses across the state and across the country as well. Please help us help you. Thank you for your time. Next, I would like to introduce Tracy Hayes from Mount Carmel.
Excuse me. My name is Tracy, and I'm a nurse at Mount Carmel. We've been taking care of COVID patients since March of 2020. That's 600 days, over 600 days of taking care of COVID. My unit is a intermediate medical surgical care unit with a specialization in stroke. But just like the pandemic changed everything, it's changed us, it's changed your healthcare workers, It's changed my unit, and now we specialize in COVID care. That's brought a ton of differences for us. That means new workflows. That means longer hospital stays. We have patients that are in the same room for over a month. That means families that can't visit. That means learning how to communicate very tough messages over a Zoom call on an iPad. I have had to hold an iPad and hold a patient's hand while they died so that their family could be with them. I've experienced more death than I ever thought I would in my career. My unit lost maybe 2 or 3 patients a year before the pandemic. In 2020, we were losing 3 patients a week. It's gotten better. We've gotten more effective treatments, and we've got the vaccine. But we're still losing people. And a lot of the deaths in 2021, maybe they were preventable. This is a continued fight. We're fighting every day. And this is all on top of the daily needs and demands on your healthcare systems. And I'm here to tell you that resources and staff and hope are down. We're tired. Excuse me. COVID cases may look like a number on a graph to you, but to us, those are our patients and our families. COVID's a virus. It's indiscriminate. It does not know gender or faith or politics or socioeconomics. The best way to fight a virus is prevention. And the best preventative methods are vaccines and boosters. It's socially distancing, it's staying away from those that are sick, it's wearing a mask, it's washing your hands. Maybe you know somebody who got COVID and wasn't a serious case. And we've known people that have gone home from the hospital, and that's fantastic. But we all know too many that didn't go home and that can't see their families. It's been over 600 days of fighting, and we're tired. We're asking for your help. Please take care of yourself. Please protect yourself and your families. Thank you. Dr. Roberts?
Well, I just want to thank Nate, Jennifer, and Tracy for everything you and your colleagues do every day. I know it's not easy. I appreciate you sharing your stories this morning. This is tough. You know, our nurses and our healthcare professionals, we wake up every morning trying to figure out what we can do to protect our community. It's a constant battle. We don't want to see people die. We don't want to see people get sick. What we want is for people to follow the preventive messages that we've been sharing almost since March of 2020. And now, as of a year ago, we have a vaccine. And still, here in Franklin County, 40% of our population is not vaccinated. So what do we want you to do? We're talking about COVID, but as Nate mentioned, we're talking about everything. If you come into the ER and you need medical attention for something non-COVID related, you could experience a delay because our hospitals are so congested with COVID patients. So think about that. If your grandmother has a heart attack or a stroke, if you're in a car accident and need a medical attention, all of that care could be delayed as a result of the congestion that we're seeing with COVID-19. So what do we need you to do? Get vaccinated as soon as possible, and if you're eligible, please get a booster. Wear a mask indoors. Dr. Thomas said it very clearly. In the city of Columbus, as well as in Whitehall and Bexley, there are indoor mask mandates, but a lot of people are not following those rules. please wear a mask indoors, even if it's not mandated. And if you're a business owner, no matter where you are, please encourage your staff as well as your patrons to wear masks. That's how we're going to slow this down. Test before you gather. If you have access to an at-home test kit, I strongly encourage you to test before you gather. And most importantly, if you're experiencing any symptoms, don't go. Don't go to that gathering. Don't go to that school function, that church function. Omicron is presenting very different than previous variants. Not everyone has the loss of taste or the loss of smell. Sometimes people just have a sore throat, a headache, not even fever. It could mimic a cold. It could mimic a sinus infection. Stay home until you figure out what it is before you expose other people. And then wash your hands. That's very common and very simple. It's a great public health prevention method, washing your hands as frequently as you can. So we all must act now, today, not tomorrow, not after Christmas, but now, as we're at this critical juncture to help reduce the spread of this virus in our community. We're happy to answer any questions any of you might have for us this morning. Thank you.
We opened up the convention center for the event of overflow patients. We created mass vaccination centers. Knowing where we're headed now, is it time to start rethinking those options again? Are you interested in opening up the convention center again, or creating another mass vaccination site or mass testing site at the fairgrounds that we did at the beginning of this?
Great question. I'll try to answer them the best that I can. In terms of the convention center, that is something that we thought about collectively as a community back in March and April of 2020. A lot has changed since that time. And at this point, we as a community don't have the resources to stand up something like the convention center, i.e. we don't have staffing that can be stretched that far to make something like the convention center a viable option. So that is not something that we are considering at this point in time. As far as a mass vaccination site, we feel here in Columbus and Franklin County that we have lots of access to vaccines. You know, when we had the Celeste Center open, there were only a handful of providers, mostly public health and our hospitals. Now we have pharmacies that have the vaccine. We have federally qualified health centers that have the vaccine. Our hospital systems have the vaccine, and public health has the vaccine. So we feel that vaccines are readily available right here at Columbus Public Health. We have 10 clinics a week. And I will tell you, in January, we plan to expand that and start having more Saturday clinics that the public can access. But we feel like our vaccine clinics, as of right now, are not at capacity. So we will continue offering them in that way. I don't know if Dr. Thomas wants to add anything else or anyone.
Hi, everyone. I'm Nick Creatsulis, Chief Clinical Officer for Mount Carmel. So in regards to the convention center, we did stand it up in March, but as Mashika, Dr. Roberts mentioned, the ability to do that, we could reset it up, but again, we just don't have the staffing to accommodate if we do have to have people in that area. So that would be our response at this time. Now, if things change in the future, we'll just have to gauge it as the virus expands. But you know, it is a time of it is a time of giving at Christmas, and I just want to expand some of the comments that have been said. It's time to give back to your fellow man and try to find some time to get vaccinated. I know our offices have vaccines. I know Ohio State and Ohio Health's offices have vaccines. You can find vaccines anywhere. And there's no judgment when it comes to getting vaccinated. Your doctor won't judge you. The pharmacist won't judge you. This is the time to go and protect your fellow man here. The only way out of this pandemic mess is vaccinations, really. And as this Omicron variant continues, really, we're going to be stretched very, very thin in all of our hospital systems. So my ask to the community, our ask to the community really is to say, instead of going to go buy that extra gift, find the time to go get your initial vaccination or find a time to get your booster. That'll help your fellow man. That'll help your community. That'll help your family in general and friends. So thank you.
As far as with testing, at-home test kits are getting harder and harder to find. And also, just to kind of go off the other question, what about mass testing sites? Are there going to be more at-home test kits? And also, is there a plan to have a mass testing site?
Great question. So we do know there's been an incredible interest from the community over the last few days about test kits. And as of right now, both Columbus Public Health and Franklin County Public Health have run out of our supply of test kits. There are some still available at some of our rec centers, as well as our libraries. I understand they are hard to find at our retail pharmacies. I actually put a call into Ohio Department of Health this morning to see if we could get any more test kits in Franklin County, so stay tuned. I understand that when President Biden speaks this evening, he will be talking about a larger nationwide plan to get test kits out, so we're anxious to hear that and see how that will help. In terms of mass testing sites, I can let our hospitals speak, but our hospitals are doing testing in drive-through settings, and we here at Columbus Public Health, if you want to get tested by a hospital system or a PCR, not just a home-based test, you can call us at 645-1519, and we can make arrangements to get you tested. That's been a service that we've continued even after the Celeste Center closed. Not a lot of people take advantage of that, but we do offer that. But I don't know if Dr. M or Dr. Thomas wants to talk about their testing.
Yeah, I'm Amy M., System Vice President of Quality and Patient Safety for Ohio Health. And just to expand on what Dr. Roberts was saying, we really encourage testing. If you can't find access to free testing, what we do discourage is please don't go to the emergency room just for a test if you're not ill. If you are seriously ill, please do go to the emergency room and they will test you. Similarly with our urgent care centers, as we've been able to get free tests for the state, home-based tests, we've been passing those out if, again, you don't need clinical care. I think all of our health systems have tried to make it very easy to get a test. So I know through Ohio Health, and I suspect through Mount Carmel and Ohio State, we have mechanisms for you to order your own test, show up at one of our drive-through centers. Access is on our website. We can get more information if necessary, but we've all been taking the steps necessary to remove the barriers to testing as much as possible. We encourage people to get tested before you gather, and there are a lot of ways to do it, but we do recognize that some of the retail options that were good for a while have been running a little bit thin. And again, as Dr. Roberts said, President Biden is going to be announcing more of a national plan tonight. So we all need to listen to that and understand what those mechanisms will be to get testing back into our communities. Thank you.
Any other questions for us this morning? Well, I just want to reiterate that we're at a critical juncture and we really need the community's help. Again, we get up every day because we care about this community and we're trying to figure out what we can do to slow the spread of this virus and save lives. And we just ask the community to care as much as we do. Thank you.